Welcome along and thanks for choosing Fix My Elbow. My name's James and I'm a chartered musculoskeletal physiotherapist and founder of Fix My Elbow, and I'll be guiding you through the program from start to finish. The following video will outline exactly how the program works and how best to follow it, so keep watching. One of the first questions patients ask me in clinic is how long will it take to fix the problem? And unfortunately this is quite a hard question to answer, as there are many different factors that affect how quickly a person will heal. First off, we've got tissue healing rates. For example, tendons and ligaments take slightly longer to heal than muscles, as they have a poorer blood supply and as a result less oxygen. With less oxygen, it just takes a little bit longer for tissues to heal. Now, tennis elbow is a condition which predominantly affects your tendons, so it takes a little bit longer to heal than a muscle strain. The other thing to consider here is your age. Generally, the older you are, the longer it will take to heal. So you might just need to take an extra rest day or two depending on how you're feeling during the program. Another key factor is what you do for a living. So if you're someone that works with your hands, and this is generally the vast majority of us, then you could be aggravating the problem at work, and again this might just take you a little bit longer to resolve. As a very rough guide, I've set the program out to run over about 12 weeks. However, due to everything I've just mentioned, please be aware that this could take a little bit longer. I think the key message to take home is to stay consistent and try not to rush through the program. We're trying to make really good, long-lasting, successful changes into your arm, and generally this will just take a little bit of time. So the rehab program itself is split into 3 phases. We've got pain relief, mobility, and then strength. In order to determine which phase of the program you should begin with, you need to first complete the self-assessment videos. So these are very simple tests that will give you a pain score, and from that you will be then directed to start at a particular phase of the program. The majority of people will start at phase 1 unless you are someone that has very low levels of pain in your elbow. It's really important you begin with the correct phase of the program. For example, if you're in a lot of pain with your arm and you jump straight into phase 3 strengthening exercises, you may actually end up aggravating the problem and making your recovery time a little bit longer. This is why it is vital to start with the self-assessment techniques so you can safely begin the program at the correct phase. After you get to each phase of the program, there will be an introductory video along with a handout PDF that you'll be able to download and view for your own records. This will explain exactly what exercises we will be doing along with the reps and sets. It will also include any relevant notes about each exercise. Ideally, I've designed the program so you simply press play on the exercise video for that day and then carry out the exercises with me. It's very important to mention that if you complete phase 1 and 2 and manage to resolve your elbow pain, you may be tempted to stop there and think the job is done. Please try and see it through till the end, as phase 3 is incredibly important for strengthening the arm up so that you don't develop elbow pain in the future. Hopefully that's clarified everything you need to know about the program and how it works. Don't worry though, I'll be guiding you through each phase so you always know where you are. The next video will help you diagnose whether you're suffering from tennis elbow or golfer's elbow, and then from there I'd like you to watch the educational video for that specific problem. Thanks, and see you in the next video.